They did a study a while ago that they found like 100% of thoroughbreds on the track had ulcers. And I believe it because it's a very stressful environment. These horses are under a lot of stress. They're coming and going. There's new people. There's hardly any routine, things like that. So your risk factors include a change in the environment, whether that be herd, moving barns, what have you. Inconsistent routines. Horses love a routine and they get very upset if they don't have one, and it can result in their gut being painful. A lot of trailering and a lot of showing. So athletes are much more prone to ulcers, and I find, than your kind of like horse that doesn't leave the homestead. Periods of fasting. This is very important. If your horses are meant to eat all the time, whether that be grass, hay, don't feed them grain all the time. But horses that fast for hours and hours on end are much more prone to developing EGOS than horses that are more of on a consistent free forage situation. Chronic NSAID use, such as bute, banamine, or even firocoxib, and underlying pain issues. So I had one last week, actually. This horse had ulcers for about 18 months as a new patient to us, and he had been scoped 3 or 4 times, and they just couldn't understand why, because they were doing everything right. They couldn't understand why they weren't resolving. They changed his job. They moved into a different barn. They gave him a friend. So we did a lameness assessment on him on Thursday or Friday, and he had terrible back pain. So we got in this discussion. I looked at their saddle. The saddle didn't fit very well. The horse was very sensitive to palpation. So I'm excited to treat this back pain in the hopes that the ulcers will resolve, because he has probably had it for the 18 months he's had ulcers, and that just acted as a nidus for basically a cause of the ulcers. The environment must be changed. You can do any medication I suggest, but if you don't change why that horse is stressed or painful, they're going to get ulcers again. So if there's pain, treat it. If the job is stressful, change the job. And if the horse is lonely, get it a friend. It is not just simply, here's some GastroGuard, the ulcers will get better. It is what is causing the ulcers.